Coming up, how college football stars and free agent wannabes go to pro football camps and the difference it makes for you. I'm Dr. Charles Martin, but you can call me Charlie of MasterYourPractice.com. It happens every year. Newly minted college football stars and free agent wannabes go to pro football camps. These players train for months before ever arriving to the training camp. The camp itself is both physically demanding and mentally tough. Some make it, some don't. Even proven veterans get the "we're sorry, but we're going to have to let you go" talk. Who deserves to be on the team and receive a sizable paycheck is the question that coaches and managers ask themselves in the process of player selection. The process can seem brutal. One mistake in a scrimmage or preseason game and a player may find his locker cleaned out for him come Monday. What is the basis for these decisions of who to keep and who to cut? In a word, performance. Players are kept and paid to the degree they can perform. Poor or declining performance, as in the case of an aging veteran player, equals a pink slip. Those that perform well consistently over time have multi-year contracts. Those that don't will be terminated. The term NFL stands for not for long. This is a form of sports Darwinism. Survival goes to the player who adapts his skills and talents to the situation. Those who fail to adapt are removed. Guess what? This happens in your practice too. Performance matters. Who defines performance? The profession defines performance based on science and the appearance of clinical results. Patients define performance mostly in other ways because clinical skills and application to the sciences are expected. What is your definition of performance versus that of your patient's? Think about that for a moment. A patient will fire you if your performance doesn't match what he or she believes it should. You perform to her expectations or his, or you're just cut, just like the pro football players. Now, performance takes many forms. The curious condition for most professionals and small practice owners is the denial of the various areas where performance is required. No, most of them are concerned with their thing, their performance, ignoring the other areas of performance that paint the complete picture of success. It's not enough to be a technician in just one area. You must learn to either perform at a high level in all those required areas or hire those who can. Even with delegation, you still have to know what performance should be in all the areas. There's one you can't delegate. It's leadership. You are in charge. You have to assume the role and perform. This is one of the areas that unfortunately most often gets too little energy and effort. Sadly, I hear too many doctors say, "I'm just not a good leader." The bad news is that holding that thought in one's mind as a frame of "this is just how I am" doesn't help. While prior performance may have been lacking, the real danger is this frame of thinking that inhibits present and future performance. If your prior performance in a specific area is poor, there's good news. You can change it. Yes, it will take some training and coaching. That's normal. You can become an excellent performer as a leader by allowing yourself to be defined by the present and future instead of the past. That was then. This is now. Allow your present to be dictated by your desired future, not by the undesirable past. And yes, it is a choice as long as you believe it is. Funny thing about it is, allowing the past to dictate your future is a choice too. How do you choose? We can help. I'm Dr. Charles Martin at MasterYourPractice.com. Please call me Charlie and come visit us at MasterYourPractice.com.